Is can actually be a bit confusing. Some people might go through a phase called hashitoxicosis.
Hashitoxicosis.
Yeah, and paradoxically, they might get mild hyperthyroid symptoms.
Wait, hyperthyroid? But isn't Hashimoto's the main cause of hypothyroidism? That sounds backwards.
It does. It seems counterintuitive. But in this early phase, as the thyroid cells getting damaged, they can leak stored thyroid hormones into the blood.
Ah, like a release valve opening up temporarily.
Kind of.
Yeah.
And that temporary surge can cause symptoms like fatigue. Yes, even fatigue can be part of it, but also weight loss, palpitations, feeling hot all the time. It's like the thyroid briefly flares up as it breaks down before function really declines long term.
So, a temporary spike before the eventual drop. What happens then as it progresses?
As more and more of the thyroid tissue gets damaged by the autoimmune attack, well, that's when the more classic picture of hypothyroidism starts to emerge.
And those are the symptoms we usually think of with an underactive thyroid, right?
Like the classic ones are that persistent fatigue,
Hmm.
maybe gaining weight without changing habits, feeling cold when others are comfortable.
Yeah.
But the list can be pretty long. People might also notice dry skin, brittle nails, hair loss, constipation, muscle weakness, joint pain, even depression, trouble concentrating, memory issues.
Wow, that's a whole range of things. It sounds like it could be easy to blame those on stress or just getting older.
It absolutely can be,
Hmm.
which is why diagnosis sometimes takes a while.
Yeah.
Another physical sign that can crop up is a goiter. That's an enlargement of the thyroid gland in the neck. It usually feels firm, kind of rubbery, and typically isn't tender or painful.
Okay.
And then in really severe, long-standing cases of hypothyroidism, a more advanced condition called myxedema can develop.
Myxedema. That sounds serious. What is that exactly?
It is serious. Myxedema is basically a very severe stage of hypothyroidism where the body's functions slow down significantly. It's actually a medical emergency that needs urgent treatment.